Okay. So welcome, everybody. It's August 22nd, and very thrilled to be with you today, and looking forward to my colleague, Charlie Fiske. Federal policy, even though it's not specific to disability, it clearly is very reflective of what we'd have to do in terms of national policy, and it obviously touches people with disabilities too. You'll see the themes. It relates to the National Organ Transplant Act, but it didn't start with that idea. It started with a specific story, and it happened to be Charlie's daughter. So I'm really looking forward to that, and hopefully you are too. Let me start the slideshow at this point. And okay, so just our mission: enhancing the lives of people with intellectual and developmental disabilities, including autism and their families. We fulfill this through advocacy for community supports and services that foster social inclusion, self-determination, and equity across all aspects of society. And our mission really is fueled by you and others through your donations and support. Obviously, advocacy is not a publicly resourced thing, so you can go to thearcofmass.org or arcmass.org, and you'll see ways at Donate Now to support our advocacy, and hope you will. So today we're going to introduce Charlie. We're going to have a 12-minute video from the University of Minnesota Department of Surgery. In fact, this is a very recent video, even though the story is from the 1980s. And then Charlie will talk with us about family, state and federal advocacy, and policy change. Then we'll have some time for questions and comments. So let me introduce this guy. Look at that picture. Wow. I don't know where I found that, but I like it, Charlie.
Thanks, Leo.
He's going to talk. So welcome, Charlie, first place. Hopefully you're glad to be with us. Let me let you say a couple of words, and then I'll give you your background.
Thanks, Leo, for the opportunity to be here. And I work with a great group of people here at the ARC, including Leo and all the rest of my colleagues. And the story we went through is some of the difficulty we faced as a family, and where do you go with that? And the story kind of tells the video kind of tells it much better than I could possibly do. But again, thank you, Leo.
Okay, you're welcome. And so, as I said, his story starts about Jamie and the family and the National Transplant Act of 1984. So, wow. But his work started before that passed, obviously. And it's very similar to if you have a child with a disability or an adult with a disability, what really drives you to make things happen. And Charlie has a diverse background in communications, lobbying, and policy development. He plays a key government affairs role at the ARC, in fact, since 2015. And he was a volunteer, at least during the previous decade. It might have even been longer, where he would attend the government affairs meetings regularly. And here's a picture, just to give you a feel of some of the key players in advancing policy. And there's Ted Kennedy and Orrin Hatch, a Republican. It was a bipartisan effort. Charlie will, share. And then Congressman Moakley and Congressman Gorey, he was a congressman when he sponsored the bill. And Ronald Reagan was president, and he signed the legislation. So, it's 40 years ago. Jamie needed a liver. So I'm going to, without further ado, without reading you this, she was 11 months old, but let me let the video do the talking. It'll take me a second to get that to you. Okay.
Jamie. Putting this in the Senate budget.
Oh, what happened here? Woo, sorry. I don't know what just happened.
Wow.
Obviously something.
Jamie Fiske.
Jamie Fiske.
Doctors had predicted she died without a liver transplant.
The insurance company was adamant that they weren't going to cover it.
They assert that it's experimental.
She was on her last leg.
Could we do anything for her?
We were under the microscope.
That nationalized system needs to go into effect immediately.
So that when donor organs are available, the best recipient will be able to receive those.
It's astounding that one child has touched so many other lives.
Jamie was born Thanksgiving morning, 1981. About maybe 3 weeks or 4 weeks after she was born, we noticed that her eyes the white parts of her eyes were turning yellow. And I remember the doctor coming up. He looked right at me, and without blinking an eye, he said, "Have you thought about having other children?" She had a condition called biliary atresia. She's dying. She's not going to survive. And the only option was a liver transplant. Liver transplants in '82 were considered experimental.
This was the thing that drove me the most, to find a way that we could, in fact, transplant organs from one individual to another. Wouldn't this be wonderful if we could do it?
When we were approached by Jamie's parents, her skin was paper thin. You could see blood vessels everywhere. There had never been a successful liver transplant in a child that age.
The insurance company was just adamant that they weren't going to cover it. The ombudsman got on the phone with me and he said, "I know what you're going through." And I said, "Doug, you don't know what I'm going through. It's not your kid that's dying. What are you talking about?"
Many families are put in a position where they feel like they have to get national publicity in order to get enough attention to get their child on the transplant list.
So we started a kind of a crash course in Media 101, reaching out to the assignment desks in New York City, ABC, CBS, and NBC. Got a little profile with Jamie's picture and sent it to them every single day. And we did the same thing with every single politician that we knew.
It was just something about Marilyn and Charlie. They made you want to help them.
And I think the media people that we dealt with were really good at teaching us how to talk, how to present stuff.
Very simply put, our daughter needs a liver transplant. Can somebody out there help us? You know, at the time, transplant stories really a rare occurrence.
Went back to the insurance company and they said, "Well, you have to understand, this is experimental." And I said, I don't want to say anything, but I've got Charlie Austin from Channel 4 who's sitting here only one side of the conversation. You want to repeat that? He hung up.
When I was asked to see her, here there was this cute little thing, and she was as orange as a pumpkin.
I thought, oh my God, I hope we can find a donor for her. At that time, the organ procurement community was not established whatsoever. Most children with biliary atresia die before age 1. Jamie was 11 months when she came to the University of Minnesota. So she was on her last leg.
And I'm thinking, oh my God, we're in Minnesota, in a place we don't even know. We know nobody there. Bringing Jamie to a group of strangers who have not operated on somebody that young.
We were under the microscope at the time.
Jamie's situation was extremely visible.
And so for Dr. Nigerian, I said, the media, everybody's there. Everything's going to go to hell if she dies on the table. He said, of course, I know.
What if she died? Then you've got all this national media. Oh yeah, Dr. Nigerian was the doctor to operate on. That's taken a huge risk. I got a call. "Hi, this is Ted Kennedy." And I thought it was one of my friends kind of just tripping me. He said, "No," he said, "this is Senator Kennedy." He said, "I understand you've been contacting my office about your daughter. What can I do?" And I said, "Well, I don't know, Senator. Possibly I could get in front of the Academy." It's okay. 10 minutes later, Dr. Jennison calls me. "Yeah, we're going to let you speak." I had a chance to address probably 300 pediatricians.
When Jamie was sick, I took you and I called you. When Jamie went to Children's Hospital in Boston, I trusted you. When she went to University Hospital in Minnesota, I trusted you as pediatricians. I know within 1 week, at least one person in this room here will see a trauma situation where possibly a donor liver could be identified. I ask you to keep your ears open. She is my sunshine, and I love her.
His plea to the American Academy of Peds was on the news. And a family in Utah whose child had died specifically requested that their child's liver be gifted to Jamie. You know, it's humbling to realize that this family were able to move beyond their own grief to be so generous. So that's why we got the call to go to Utah to take out that liver and bring it back.
It's the thing you want to have happen, but it's the thing you don't want to have happen. The last flight out of Boston was at 6:45. Then you feel helpless. There's nothing else to do. There's no place else to go, nobody else to call, nobody else to tell Jamie's story. That was probably the hardest. You want that operation to go forward, to take place, but also maybe the last day of her life.
I remember them coming in with the liver, and I was in and out of the OR at the time and talking to Marilyn and telling her along the way what was transpiring.
I think we heard about 5:30 yesterday. There was a possible donor. It's one of those times that you always wonder what it's going to be like when the time comes, and then the time comes and you do the next thing and you're with Jamie, and she was terrific. She played and laughed and did her peekaboo games right through all the pre-tests, and it was very tough on her mother and her father.
By the time I got the operation, we were just about finishing up.
I know what's going on. Jamie's doing.
I went upstairs and within 15, 20 minutes, Dr. Najarian came out and he said, her liver was like a piece of petrified wood. He said, I don't think she would have lasted another day. He did buy her time. He did buy her time. And I think that's probably the most he could have said. I think we bought her another day.
Jamie Fiske of Boston received a new liver following a nationwide appeal by her parents. Tonight, she's in the hospital's intensive care unit.
Her first birthday is November 26th. What a birthday present to the Fiske family and the people in Massachusetts, people in the nation who've been pulling for her to make it.
Marilyn was feeding her Cheerios and she grabbed them up and ate them. She said, "This child is starving to death." You know, Jamie felt so good that she was hungry. And Marilyn had never experienced that with her.
Probably the most joy in my life with Jamie was we're able to discharge her for Christmas and hear this little pumpkin. She looked like a little pumpkin. Now it changed to just an absolutely delightful little lady.
And lo and behold, a surprise to us all, she lived.
She was a poster child for successful transplantation in a pediatric patient and basic human generosity.
It's making a very strong impact, surprisingly so. It's a wonderful gesture for the family to do that, to family in their time of grief, to actually put a piece of their son into another child's body so that child can have a healthy and happy life.
She became kind of the basis of all of our work in transplantation from there on.
I got a call from Tennessee. I'm Al Gore. Would you be willing to come down and testify in front of my subcommittee?
The last thing a family needs to do is come to the politician or come to the media for help. That nationalized system needs to go into effect immediately.
So that when donor organs are available anywhere in the United States, that the best possible recipient will be able to receive those.
It's astounding that one child has touched so many other lives.
If you mention Jamie Fiske, I can't help but smile.
And I said, I don't know, Dr. Najarian. I looked at those notes and there was probably about 13 things that should have prevented you from operating on her. He looked right at me. He said, I took a chance, yeah, but I took a chance for Jamie. Well, right now, that's almost 40 years. So we bought more than a day.
How old are you gonna be, Jamie, in November?
November 26.
26.
Wow, pretty intense. Charlie, wow, what a video. Whenever I see it, it has the same impact. Anyways, let's talk a little bit about that.
Sure.
If you can. I'm sure it brings a lot more to you than to me, and I'm feeling pretty shook up here. So yes, bought 40 years, and again, it made it seem so easy, the video. And it wasn't that easy. And I was thinking, we talked about starting with sort of just as a family, similar to a family that had a child with disabilities facing insurmountable barrier. You guys faced that, and
Right.
you had to decide how you're going to approach it. Obviously, it was an immediate right thing, as it might be when people have co-occurring conditions, right? Medical and others. And yeah, go ahead.
I think the difficulty in all of that, Leo, there's no roadmap of how to go forward. It's just not there. And you're told your daughter has a terminal condition called biliary atresia, and she had 2 operations in '82, basically to try to correct that. But what happens is the bile ducts in her liver dry up and they cause cirrhosis. And so it meant a liver transplant. And the first thing we ran into was who's going to pay for it. Blue Cross Blue Shield said, we're not going to do it. It's experimental. And so which prompted us to say, who can we reach out to? And we started reaching out to the media, reached out to Governor Ed King, who very quietly had one of those conversations that never took place to say, we'll take care of it from the state's end. Also reached out to the Speaker of the House, Tom McGee, who said, I'll see what I can do. And I know there was lateral phone calls made to the insurance company. In addition to that, we bombarded the local media. That became the story that the Blue Cross Blue Shield was blocking care for Jamie. And they basically came right at, including all the TV stations as well as the media. And Blue Cross Blue Shield blinked. And they said, we'll cover it.
Was the Enterprise reporter a big factor in the beginning to get the
huge factor? Yeah, that was the Enterprise is a local newspaper in the Brockton area.
Right.
And the reporter, Kent Jones, did that local story. And we used, once it's in print, then it's easier to go to other places. So I could walk into a TV station with printed newspaper to say, this is an article that took place and it's verifiable. They were a huge factor.
So we shouldn't take a local paper for granted and how that can be
absolutely
a pathway.
not.
Yeah.
I think what happens is when something gets put in print, it takes on a quality that it's true. And it allows me to go to channel 4, 5, and 7 and say, here we are. We're stuck in the middle of this. And even reaching out to people. At that point, Tom Ellis was with Channel 7. And I got a hold of him through a relative, and he called me and said, I'll see you the next day for 5 minutes. And I went down to Channel 7. 5 minutes became 2 hours. And come to find out, Tom had a kid that died in childbirth. And so he was very partial to that whole thing. And it allowed him to become part of the story. And then
for those of you that don't know, Tom Ellis, just historically, he was a huge anchor, went to New York, and sort of was too bad because he wasn't as well received in New York, but he was a mainstay here for a long time. So that
he
was
was on all 3 stations here, and pretty credible. And once that was in place, we stood back and said, okay, who now can we talk about Jamie's situation? And we started reaching out to the networks in New York City, the assignment desks, reached out to Nancy Reagan, and again to Senator Kennedy, Congressman Moakley. Every single day we called them with kind of like an updated press report. Here's where Jamie is, and she's got X amount of time to live, we think. And come to find out, we discovered that there was a group called, they're still there, the American Academy of Pediatrics. We're having their national convention in New York City at the end of October. And we said, why not? So in terms of that, we reached out to the Academy and at one point found out from the head of the Academy, well, if you thought there was media coverage, we could think about it. We went right back to all of our media sources and say, look, if we've got media coverage, we can get in front of the Academy. And that's when Senator Kennedy called me. He said, what? He said, you've been calling my office every single day. And I said, I know, Senator. He said, what can I do? I said, can you call the head of the Academy? Here's his name, Dr. Jennison. He called him 10 minutes later, Dr. Jennison, the head of the Academy, said, well, I got a call from Senator Kennedy. And I said, who? And he said, Senator Kennedy. I said, I don't know him. He said, well, you know what he wanted? He wanted you to speak in front of our group in New York City. And you know what trouble he could cause for us? I said, I can't control Senator Kennedy. I'm sorry, doctor. He said, well, we'll let you speak and get in front of the Academy in the end of October. And as it worked out, the networks covered it. The local papers covered it. And in a small town in Alpine, Utah, there was a parent watching TV. And I got up and talked for a couple of minutes about Jamie. And Laird, the dad, said to his wife, Leanne, come on in here. I want you to listen to this guy's talking about his kid. And sitting in front of Laird was his own son, Jess, who was the same age as Jamie. And 5 days later, Leanne and her girlfriend and 2 of their kids were involved in a car train accident. They remembered that someplace in the country, somebody was looking for a liver, and they consented to the donation of their son's liver for Jamie.
Who knew, right? So on the Senator Kennedy piece, was that a coincidence, the timing? Like you had been reaching out to him all along, or
we call Kennedy's office every day without
all along,
I think,
but not just for the Academy.
As it worked out, Jamie's godfather said, I've done some research on Kennedy, and he's got a person on his staff named Melody Miller. And I said, who's that? And he said, it was somebody that had worked for Bobby Kennedy, and Ted Kennedy picked her up on staff. And so we reached out to Melody every single day, and also Sherry Kyman. So every day, Kennedy got a press report. So by the time he got to me, his staff had been telling me, this guy's been calling us every single day. And it made a difference.
So it was fortuitous. It was a good coincidence that he happened to call when you needed that extra nudge besides the media to get you in front of the Academy, right?
Exactly. It made a huge difference. And the same with Congressman Moakley, who at that point was chairman of the Rules Committee. And also one of the behind the scenes people was Tip O'Neill's son, who was lieutenant governor at the time, Tommy O'Neill. Tommy stepped into the middle of this, reached out to his dad and said, look, this guy's needing help. So you have those people behind the scenes. And then there was enough pressure put on the Academy, political pressure, to say, let this guy speak. He's talking about his daughter, who's at that point 11 months old.
So here's what we got for if you think about the series of events, right? You've got Blue Cross, refusing to pay. What we haven't talked about, we're not, and we probably don't want to, because I don't think we need to get into that. You finding Dr. Nigerian through other physicians, whatever, getting referrals. You've got Blue Cross finally agreeing to pay. You've got the media pressure you've put on. Now you got to find someone with a liver, because at that age, it's got to be small enough. So there's 4 or 5 things, happening concurrently, let alone your outreach to the legislators and decision makers to help facilitate all of this. And then what we haven't talked about, I'd love to segue into, is what moment or what series of moments segued you into more of a national, we need an act for this. How did that layer on? It wasn't all of a sudden, right? Did it sort of creep up, realizing your daughter's going through this and other daughters may be going through this? Go ahead.
I think, Leo, what happened was with the initial thing we ran into was Blue Cross Blue Shield. Once that was done, we knew that the operation would be covered. The other thing, they never operated on anybody that young ever. There was only one place doing liver transplants in Pittsburgh, and the other one that was just starting was Minnesota. So we said, why don't we tell Jamie's story to as many people as we possibly can? We learned pretty quickly that getting into the wire services on a daily basis, AP and United Press International, every day they got a report. Did the same with the Globe, with the Herald in the Boston area, and then made contact with the assignment desks at ABC, CBS, and NBC. And CNN was just starting in '82. So every single day they got a press report about Jamie. So after a while, they would be hearing us constantly, and we just began going from there. And part of it was, how many people can we tell about her situation? And we also knew that we were running out of time. I mean, we knew within a month it would be over one way or the other. So part of it is, how can we talk about Jamie, who is at that particular point, 10 or 11 months old, and that she needs a liver?
What got you though to take that which, by the way, that was awesome, that summary. What got you to take that, you and Marilyn and Jamie's spirit, right? To get that though to become a national issue for others too.
I think what drives
you,
it,
Jamie, to let's pass this act, or did you just suddenly find yourself, you know, with in the middle of all this, and you know?
I think part of it gets driven as a parent and the advocacy. What can I do for my daughter? How can I possibly help? And you know, you can't do the operation. You can't find a liver necessarily, but you can tell anybody that's willing to listen about that. And we figured we'll keep talking. Every single we reached out to politicians all over the place, locally as well as. Go ahead.
And when Al Gore called you, was that what opened the door for you to say, okay, I'm gonna
after Jamie's
after
Jamie's operation, because of the attending publicity, I got a call in early February of '83. Hi, this is Al Gore from Carthage, Tennessee. I'm a congressman, and I want to see something. I said, well, Congressman Gore, what's in it for you? I can almost hear him smiling. He said, well, Labarnus Children's Hospital in Memphis, Jimmy Williams, the surgeon, has been on my case to do something about organ transplant systems and nationally. Would you come down to Washington and testify in front of my subcommittee and tell your story? So I did that. And he filed that on the House side. And then on the Senate side, the Senate was controlled in '83 by the Republicans. And so again, I get another one of those phone calls from our good friend, Senator Kennedy. Hi, Charlie, this is Senator Kennedy. And I knew it was him at that particular point. He said, I'd like you to come down to Washington, but I'm not chairman of that committee. He said, my friend Orrin Hatch is chairman of that committee. Would you be willing to meet with Senator Hatch? And he said, and you're going to come and see me when you're down here. So I went down and testified and met with Hatch and testified in front of his committee. And at that particular point in '83, the administration was really against any more expanding programs. And so I said to Senator Hatch, I said, you know, the people up the street, referring to Pennsylvania Ave, they don't want another act to go into place, nationalizing anything. He looked right at me and he said, you know what? He said, they need me more than I need them. And besides, the donor came from my home state, and I know about that. I want to do something with this. So he, with Kennedy on the Senate side, got the National Transplant Act done there. And the bill ended up on Reagan's desk in October of '84 because it had bipartisan support from Hatch.
Wow. So that's really what got you on the bigger picture.
Right.
You were probably exhausted, is my hunch, right? After going through all that, you and your wife, and just trying to get back.
I think we didn't start out to do anything national. We just started to what can we do to keep Jamie alive? And one thing kind of led to the other. The other thing we were getting to was multiple phone calls from the White House. Multiple. We've got a case here. Can you help us with it? And so we befriended the White House, and we're doing a lot of stuff behind the scenes that we could do because of the publicity. So the White House was very instrumental in a good way to not block the National Transplant Act, which basically set up a national system. There was no system in place for matching organs with recipients. It just wasn't there. And this called for a national system. It called for a commission to take a look at it. And then passing that allowed a national system to be set up. It's called UNOS, United Network for Organ Sharing, to match up across the country donors with recipients. And I think part of it was people don't need to go to the media when they need healthcare. And I look at Jamie's situation with getting in front of the American Academy of Pediatrics. God forbid there was a plane crash that same day at Kennedy Airport. Me getting in front of the Academy is certainly not the equivalent of a plane crash in LaGuardia. So if you're depending on the media for healthcare, you're really competing against forces you don't even know about. So there needed to be something more than me just going to the media and getting a liver for Jamie. It had to be more systemic than that.
Do you think the average, well, it's probably a stupid question. Did you get questions that day from pediatricians? Were there questions about it, or did they pretty much listen to you? And
they just listened. I told them I would talk 2 minutes, and I talked 2.5 minutes. That's all I wanted. Held up her picture. And I said, one of you, some point in the next week, is going to see a potential donor. The address to them was important, but I think it was the media coverage that really generated the visibility to say to other people. Alpine, Utah, where the family of the donor came from, they would never have heard of the American Academy of Pediatrics or even Jamie, but they're watching TV that night.
Right. Yeah,
And their
it's huge.
generosity with their son Jess's liver changed Jamie's life. And these are
Right.
people who were pulled into the middle of this just by accident and watching TV. So, and to put a
And so-
national system in place. And also, you don't need people getting in front of the media say, I need a liver, I need a heart, I need this and that. It's not the way to have a system work properly. That's all.
And so what's interesting, there's been a few, I've noticed on NPR shows on the system and improving it. So it's
Right.
continually being discussed, and so what's been in place now for obviously 40
Well,
years.
the Transplant Act set up a commission, and they divided gave it out to a company called UNOS, which was part of Southeastern Organ Procurement Foundation. And I sat on their board for 4 years. So I was hanging with all the transplant people because I had a big mouth and I had visibility. And I did things that they were not able to do. And it set up regionally 6 different areas around the country so that organs could be matched up equally. And it's effective. There's always things could be improved, but it's certainly much better than it was. And transplantation has gotten much better.
Right.
And don't forget, transplantation started here in Boston with Dr. Murray back in 1955 with kidney transplants.
Right.
So there's a long history
good
here.
point. Good point. So let's tie this into disability a little more. By the way, Nancy G wrote, Charlie, you're incredible and we're blessed to know you. Thank you for sharing your journey. We love you, Nancy and Jonathan. So good friends. And
thanks, Nancy. Yes.
Jonathan's-
They are great advocates at the State House, the two of them.
They're very involved, the ARC.
They work miracles, the two of them. Yes.
So, how do we apply this, thinking through this, when somebody obviously we had some big federals, again, there's a discrimination, right? Oh, she's a baby. Do we really want to spend these resources on 11-month-old?
Right.
They'll have another kid. Just, procreate, folks. Do you think kids are endearing? And that helped. I think it probably helped the case, right? Once
it helped that it was a little baby. I mean, it was helpful. It wasn't like an adult that's 35 looking like they're 40.
Right.
And it's much more attractive. A kid's story plays better. And that
then with disability, we sometimes have, again, cute kids with disabilities are sometimes more appealing than adults, but we do have the whole healthcare discrimination piece, right? That's been here.
I think the hardest part for parents and families and people with disabilities run into it. They keep knocking on doors and keep getting turned away, or they get turned out of emergency rooms. And it's really, really discouraging. I mean, with Jamie's situation, every time we turned around, there was another door that was not opening. And part of it was Jamie's godfather was just aggressive. Jamie's aunt was aggressive, and Jamie's aunt said, I worked for the telephone company for 25 years. Nobody hangs up on me. I think, okay. And even Jamie's godfather would periodically call up and people say, hey, he would pretend that he was calling from Senator Kennedy's office. Said, so you have family or friends or advocates that are working with you. And I think you really need to take a look around if you have a situation that's really overwhelming, what kind of support you can get from either family or friends, because it's so very difficult alone to get this done, especially if you have an investment with your particular family member. You just want that person to be healthy and going forward. And it's
what I want to reinforce was your personal journey, and every individual and family's journey, personal journey, can impact the bigger picture. So if you're able to succeed, whether it's advocacy at the school, advocacy with DDS, advocacy, whatever, you're actually having an impact for the bigger group, because you're setting a precedent, you're setting a value that people may learn from, that they're not getting it. So let me open it up a little bit, because people are going to see this in the recording, and there might be things I'm not asking that people might be interested in. So if somebody wants to ask a question or chat a question, feel free. And again, if and Maura, you're welcome to tie this into health equity a little more, and advocacy in general a little more, because I do think it resonates for me with disability advocacy, both state level and federal level, the things that went on here. And of course, Ted Kennedy had compromised with Orrin Hatch many times over the years.
Right.
Of course, he was defeated by I don't know what we call the person that defeated him. It's so ridiculous. He was already a conservative senator. I don't really even understand how he got defeated. Maybe he did too many good things working with Ted Kennedy, but they did some disability work together. But does anybody else want to add something?
Well, yeah, I just wanted to say how much this resonates around our constant push to tell the story, to use our stories, right? Because was Charlie taking this story and getting it, you know, to national attention. And you know, it reinforces how important it is for us to be able to really get our stories out there and share our lived experience to affect change. Charlie, did you get a lot of families reaching out to you who were maybe in a similar situation that, you know, hadn't been able to rise their situation up like you did?
No, only because in 1982, they weren't doing liver transplants a lot, and they're only doing them one place in the country. So there wasn't a ton of people, and there wasn't families, because if you have biliary atresia, which is 1 in 15,000 in terms of births, the outcome of that is you're probably deceased by the age of 1. So there wasn't a lot of families reaching out at all.
But I was thinking
support.
maybe with Morris' question, there might have been other organs, you know, other families dealing with barriers that might have reached
There
out.
could
to
have
you.
been.
In those days, we didn't have the internet, I guess,
Yeah.
right?
No.
Yeah, they couldn't track you down, I guess. I feel like now it would be, you know, it would be a way to learn from, you know, how did you do this and who were the right people.
After Jamie's situation, Maura, there was lots of people that reached out to us. It wasn't when we were going through it, there wasn't, you're kind of on an island.
Yeah, I meant after.
Yeah. And as a result also too, we would get daily phone calls from the White House. One of their Mike Batten, who was their communications person, would call me on a regular basis. We've got a family from Tennessee. Can you help them? We've got a family from Oregon. Can you help them?
That's what I thought. Yeah.
Yeah,
Wow.
there was a lot of that taking place because people saw what we had done as well. Maybe that's the way to go, is go to the media. And it's really not the good way to go. But politicians would call us, or Al Gore would call us periodically, say, I've got a constituent. What do you think? And it really challenged the fact that there needed to be a national system in place. It was after Jamie's situation that we began to hear from some of those people.
Okay, great.
And I think for a lot of, I mean, for us, we felt like we were really isolated. We had great family and great support, but you are pretty much alone. And I think a lot of families that are dealing with challenging situations, it is really, really, really hard. And it kind of knocks you down all the time. I often think there's a guy who's with BZ Radio, Mike Macklin, who I see periodically. He called me in October, and it was in the evening. He said, Charles, what's going on? What's going on with you? And I was really down at that particular point. He said, I want to know what's going on. And he kind of nudged me and pushed me to move forward. And it's just, I think families dealing with any kind of disability or any kind of situation, it's overwhelming. And it's very hard. It's no simple task.
Great. Yeah, that's for sure. We found that, you know, with the post-COVID stuff, as you know, we've found, you know, a lot of it due to the workforce, but some of it due to just not getting enough attention, listening from persons that might be able to coach otherwise. Anything else?
I also think having her name be out there, you know, I can remember when I first asked Cheryl Chan if we could rename the bill Nikki's Law, because we really wanted to put a name out there that would stick with people. And I remember showing this video to my sister a couple months ago when you first gave it to us. And she said, I remember the name Jamie Fiske from watching it on the news. So, you know, the name really, really does matter, really personalizes the situation.
And I think it also, as you mentioned with Nikki's Law, it says, wait a second, this is about protecting people that are vulnerable. Let's put a name with it. And it gets a name and a face that's a real person named Nikki, who was abused at one particular point. And with the work with Cheryl and Senator Moore and a ton of other people, you have a piece of legislation to say, look, at people that are easily preyed upon, they can't be working. You know, we've got to protect these particular people who are vulnerable. And having that name does make a difference. It does make a difference.
Okay. All right. Well, thank you. If there's no other questions, this has been great. I think we could both call it, you know, how to develop some national policy. We could also call it storytelling, and how important storytelling is, as Maura said. So we can include that with Maura's storytelling session as part, you know, as a 1-2. And really appreciate you taking the time, Charlie, and sharing your personal story, reliving the journey you had. And it really can't say enough, about its relevance as well.
Well, the other thing too, Leo, is the ARC is like that outside parent, like that advocate kind of stuff that can come to the table and say, look, you may not have the strength to challenge this particular situation, but the ARC is here to support you and encourage you. And take a look at the scope of the ARC programs that we're familiar with, how they're reaching out to people who may not have the strength to get stuff done. And I think, we've got a great team here that's willing to say, look, we understand what we need to do, either pushing stuff with the legislature or pushing stuff across the board, just to say, you are important. Even if your son, daughter, or family member has a disability, that's still important. And the ARC is here to support you. And that's the work that we're continuing to do.
Try to be a voice, but also hoping to build a collaboration bigger and bigger.
Exactly.
Because, there's so much on the ground. We realize the world's changed, and we need to have family groups across the state really, integrated even more and more, because we can working together, we can make a difference around in places that we don't even know. Sometimes the barriers exist, and people aren't either even following the law, let alone, executing bad policy. When we know there's a lot of places where there's good policy, we can share that and make sure other families can share that with people. So important.
I think the other thing that happens sometimes too, Leo, is the feeling of, why is this happening to me? Why is this taking place with my family member or my kid? And you know what? We're all in situations where stuff happens to us that we never planned on, never thought about. It arrives on our doorstep and it's there. And that's what makes it really difficult, because you can't put your finger on how this is happening to me and my family. But how do I go forward from here? And how can I make things better for my family member? How can I make things better for the community? And it's an eye opener. It just is. That stuff would never happen to me. Well, it doesn't work that way sometimes.
Right.
It does happen.
Well, I'm thrilled. We got a handful of parents going to train in a pilot to be coaches and resource parents, resource siblings, resource friends, whatever you want to call it. And we also want to reestablish the constituent advisory board that we had. It used to be, in the old days, it was called Consumer Advisory Board, but we wanted to be an extension of the steering committee. So that way we can have more groups outside, buy in, and feeling good about access, and so really look forward to that.
I just wanted to add, Charlie, that, none of this would happen without the strength of Jamie. And she's still incredibly strong and resilient today. So,
she has that stubborn side of her that is just sort of like in your face in a good way. She's a force to be reckoned with, which is good. And again, I go back and I tip my hat to that family in Alpine, Utah, the Ballon family, whose son would be the same age as Jamie. Jamie's now 41. His son would be 41, and they chose in the middle of nowhere to make a generous gift of their son's liver to Jamie. They're the heroes in it as well. They are the heroes.
Good point. Good point. Well, thank you. Thanks, everybody. Thank you, Charlie.
Thanks,
for us today. And looking forward to this. This will be posted next few days, and we'll look forward to sharing it.
Sounds good, Leo. Thank you.
Take care. Have a great rest of the day. God bless everybody.